in terms of getting a written response or something like that, or a meeting, but certainly we can, as an American, say, I'm concerned about this, you're a leader on this issue, you're a decision maker, and I want to make my voice heard on this issue.
Well,
so,
and I would suggest contacting other organizations such as yourself to
In
see
their
if you,
state.
in
Right.
their
In their
state, to
state,
see if you
true.
can lend
Right.
support. If they're having a rally to go to a senator's office and it's close, you know, you all could get a bus right up there.
My understanding of this event is that Move On's doing this all across the country, and this is just the group tasked with meeting this senator or getting a message to this senator. We're doing it everywhere else, so.
I think you're probably right.
We're not looking at have this group spreading out and talking to more people. We're specifically talking to Senator Mikulski.
Okay.
Yeah, because Move On has our addresses, so they put us in touch with the ones who are closest to us,
right.
Yes.
who are
Right.
our district.
But what they should do is a little bit more triaging in terms of, I mean, this is just, I'm just giving an advocacy suggestion to you all, because the work that you're doing is important. You have to speak up on any, you know, on these issues. But they should try to come up with a list, you know, of folks. It's good that you're meeting with all the delegation first. You should do that. And then come up with a list of people who are not in support of this public option, which you're in favor of. If there are any people in the Maryland delegation, which I do not know if every member is for it, but if there are any members in the delegation who are not supporting that, this obviously that's who you should be trying to have individual meetings with their legislative healthcare staff and so forth, and getting a point.
It's large enough that they are doing this,
right.
And for Senator Mikulski, who I assume is supporting public option and public health care in general, we're here to encourage her and to thank her for her efforts. For other recalcitrant members of Congress and senators, I'm sure there are people who are directly focusing on them, telling them, you know, giving them the message, do more.
Right. I understand. No, and we are grateful that you're lending, you know, your efforts behind this, and that you are supportive of what the senator is trying to do. I'm just saying in terms of, you know, getting your messaging out to a broader audience who, I mean, we're with you. We understand. We're here. So I'm just trying to.
You can use our stories to get to her.
Right. Absolutely.
We'll hope that she'll use her authority on the committee to lean on the other senators.
That's what I was going to say.
Even if she's going to vote for it, she can still use her power as a senator to lean on the other senators who might not be as inclined to vote
Right.
for
Well,
it.
if you know anything about Senator Mikulski, you know that she has no problem leaning. So she, yeah, that's done. You know, she's going to do whatever she can in her power to, you know.
Like a little attention.
Hi. Hello.
Hi.
Hello. And
How is Senator Mikulski's ankle?
she is doing very well. She's in good spirits. She's, you know, she has to have an operation, but she's not going to miss any of this healthcare stuff that's going on. She's in great spirits. She's fine.
Is it okay if, like,
Everybody
we all
else?
sign some kind of get well, like makeshift
Oh,
card? Is it
that
okay
would be
with you?
nice.
Actually, earlier we talked about we're all going to all individually will send her get well cards and you know, keep up the good work. You know, public option.
I don't. You send it here.
And now that you
can
know what
send
the
it to us.
hospital
Send it
health
to
care
us.
is
Yeah.
like, you'll pass the bill.
Okay. Send it. You can send it here. I'll give you my card before.
We could all sign this.
There you go.
Is there any word about whether she's going to be on the conference committee when it comes back, if it comes back?
Not yet. They haven't determined who those members are going to be
Which
yet.
committees is the senator on right
She's
now?
on Help Committee.
Help.
She's on the committee that passed this
Help?
help. It's Health, Education, Labor, and Pensions. HELP is the
They're
acronym.
doing a version of the bill in the Senate.
Labor and Pension. Yeah. And that's the committee that passed this first step. So she was, you know, obviously instrumental in getting that passed. And then the House side, I think they have passed 3 separate bills, and you know, it's all got to come together in one form.
They're working multiple committees. They passed one.
Excuse me?
They are working multiple bills in multiple committees. One
one-
committee has put out a bill.
Okay, so you know more about the House side than I do. That's great.
Internet is wonderful.
Well, this is the sign in for people who weren't there last year.
NPR.
Get connected.
Anybody have anything else they want to share? Any other questions?
Thank you for your time.
Oh,
Yeah.
of course, of course. This is.
Can we get a picture with you all, please?
Oh, you want me to take of you, the group?
No, I want a picture.
Picture of us with you.
There we go.
Come on, Kristen. It's all right.